Welcome, everybody. You know, we're thrilled to be here. I'm actually going to ask for a long shot before we start because I am joining all of you from the very beautiful Temasek Shop House. This is the social impact hub of Temasek. I know, it's good looking, right? Well, I'm glad all of you have joined us. Today, we are discussing investing and financing in public health. As you can see, we've got a full panel with actually less than a full hour. So let's get started. And I'm actually going to start off with comments made by Dr. Amin yesterday. It was a very insightful day one. And Dr. Amin shared that what COVID-19 taught us was that finance, well, essentially health and the economy are very tightly linked, and that health needs to be prioritized. Well, as we all know, priorities need funding. So Dr. Amin, if I could start with you. These new priorities, what's the reset and what's the trade-offs to make them happen?
Thank you very much, Jennifer. So I think when we talk about healthcare spend, even before COVID-19, we are seeing an increasing trend of budget allocation to healthcare. This is because of increased, advancement in technologies and so on. So you keep buying latest equipments and all that. And of course, the desire for us to try to, provide good healthcare to the population. So I think over the years in Brunei, we have invested in specialist centers, for example. So today we have a cardiovascular center, we have an oncology center, we have a neuroscience, maxillofacials, and so on. All these are specialist centers in order to provide better healthcare to the public. And so even before COVID-19, we are spending something like 10% of our annual budget on healthcare, equivalent to about 3 to 3.5% of our GDP. So the question now is, when COVID-19 hit, what do we do from here? So I think we need to really work together with the health ministry to try to understand how are we going to spend our money going forward. So in this case, luckily in Brunei, our Ministry of Health is also quite forward-looking. So we are able to sort of work together and to ensure that whatever we need to rebuild our healthcare system, we rebuild it a bit differently, so that we start to think about how do we spend smartly. And so that's why it's not about trying to have as many beds, as many equipments, as many doctors and nurses, but it's more about a right sizing. How do we make sure that we have enough beds, enough doctors, enough nurses, and enough equipments? And so I think this is where technology comes in. So how do we actually then look at, with every dollar spent, we get more in terms of services that we can provide to the population, but also at the same time, a better quality. And so in the case of Brunei, because healthcare is free for the citizens, we need to be a bit smarter in the way we sort of plan our healthcare spend. So despite as what I said, we continue to build specialist centers to cater for the population. So this amount is going to keep going up. And therefore, I think with technology, we are counting on it to try to help us to optimize our spending, and so that we get better quality. We'll reach out to more people so that no one is being left behind. So all of this doesn't necessarily mean we have to spend more. So we could continue our spending trend, but getting more out of it through technology and so on. Yeah.
Thank you, Dr. Amin. Technology, the answer for you. Minister Wong, finite budget, new priorities. What are the trade-offs?
Well, good morning, everyone. Very good to be here. Healthcare spending is a key priority for all governments, but I think it's also a concern for all finance ministers, because healthcare costs continue to escalate all the time. And I'm sure finance ministers everywhere are trying very hard to balance their budgets and keep costs under control. There are some hard truths in healthcare financing. People talk about the healthcare trilemma. In healthcare, you want to achieve goals: universal access, high quality, low cost. We want everything, but it's impossible to achieve all three goals at the same time, or it's very, very hard. At best, you achieve 2 out of 3. If you have access and quality, well, you have a very expensive system. And some countries run a very expensive healthcare system. America spends 17% of its GDP on healthcare alone. We can't afford that in Singapore. Some countries choose quality and cost, keep costs low. Well, then inevitably you have to have some form of rationing. You can't have universal access for everything. And some countries choose access and cost, and then you compromise on quality. So it's really about taking care of these trade-offs. This is pre-COVID, right? You always have to find some balance. We learned this also from Singapore's own experience in healthcare financing. There was a time, for example, when our hospital insurance was done through private insurance. And we realized that when you have privatized insurance, risk pools were fragmented, and insurance companies would what we call cherry pick the good risk. Understandably, I mean, they don't always want to insure people with bad risk. So they cherry pick the good risk, and the ones with not so good risk were left out and excluded and couldn't get coverage. So that was not ideal. And that's why over time we have nationalized our hospital insurance system. We now have a universal risk pool. It's mandatory. On the other hand, we have also seen in other examples where you have single payer systems, national risk pool, but if it's overly generous, right, provisions are very generous, then you tend to have overconsumption by consumers because a third party is paying for everything, and also the tendency for over-servicing by providers, because why not? Test more, provide more treatments. After all, someone else is paying the bill. And that's why over time we have evolved a hybrid system in Singapore where we continue to emphasize the importance of individual and collective responsibility in healthcare. It's not just the state's responsibility, but all of us have a role to play. And our system is a hybrid one where we have individual medical accounts, medical savings accounts for everyone. You use that for your small bills. But when it comes to large hospital bills, we have a national insurance scheme that covers the large bills. And even on the insurance scheme, we have deductibles and co-payments to instill that sense of co-payment and responsibility. That's a system that has worked for us. We continue to evolve it and see how it can be better. And with COVID, with the lessons of COVID, I think there are several things we can take back. Number one, all of us want efficiency in our healthcare system. We want to reduce wastage. We want to reduce costs. But when it comes to a pandemic and when it comes to a public health emergency, you need some buffers in the healthcare system. You need to be able to scale up quickly. So having, and that, you know, again, you have to manage the tensions. If you run a healthcare system as though it were emergency times throughout the years, I think it will be a very expensive system. So how to have an efficient system under normal circumstances, but have adequate buffers to scale up during an emergency like what we are facing now through this pandemic. That's a challenge that all of us face. And in Singapore, we face similar challenges. We've had to get reinforcements even from our armed forces. We have to bring in other stakeholders. But the point is to have an emergency plan that can allow for the scaling up of capacity and personnel quickly. That's one lesson that we have learned. Second, it's also important, as Dr. Amin said just now, in order to conserve scarce medical resources to ensure right siting. And that means, you know, not everything needs to be treated in the acute setting. Primary care is equally, if not more important. And right siting of care is absolutely important. even during this pandemic, when we have had our latest wave of infection, people who are vaccinated, you catch the virus, you can just recover from home. 98% of them have mild or no symptoms. Yet you have people who, with mild symptoms, no symptoms, go to the A&E and to the hospital wards, right? Because of fear, because of concerns, understandably, right? And so that's why we have been trying to beef up our home recovery programs and our hotlines to take care of their needs. But it just shows that if there is no right siting, it's very easy to overwhelm the healthcare system and healthcare capacity. And then finally, the third lesson, I suppose, is that we always need to look at outcomes and ensure we get good returns from our investment in healthcare spending. And the outcomes are not just about spending more, it's not just about outputs, but we do want to ensure, outcomes in terms of quality of life, in terms of positive outcomes that people can look forward to. And in this regard, I think a lot of healthcare today is not really healthcare, it is sick care. Right? You are looking after people who are sick, and not enough is being spent on prevention and on encouraging people to stay healthy. And that's something that we are also trying to do, to shift more spending and interventions upstream, tackle the reasons why people are falling sick, diet, excessive sugar intake. These are some of the reasons for the diseases that we are seeing today. And if we can have investments upstream, I think they will provide better bang for the buck and for the taxpayer dollar. Thank you.
Thank you very much, Minister Wong. Many points to come back to. I'm moving on now to Dr. Pusit. You advise the Thai government on health matters, and just listening to Minister Wong, trilemmas, not dilemmas, efficiency versus buffer, right siting, and then outcomes which are positive, concerns around sick care. How do you advise the Thai government?
Thank you very much, Lawrence, and good morning, everyone. First of all, I do agree with, strongly agree with Dr. Amin and Excellency Wong on his intervention, and because from my perspective, I think that financing and investment in healthcare is not just a burden of the country, but we should count financing healthcare as a investment in individual health. And because when we finance the healthcare will improve the population health and perhaps the population productivities in the future. So we should count the financing healthcare as an investment of the country. And to respond to the Lawrence question, Jennifer question, I would like to respond that in Thailand we generally use the term of the return of investment when we try to finance in healthcare, because we have the policy of the universal health coverage. And we generally use the term of the social return of investment to assess on how much of the health outcome was caused by the contribution of public health policy and interventions. And we employ the economic evaluation in terms of the cost effectiveness analysis and cost benefit analysis to compare the cost and benefits of any intervention, where both are expressed in the monetary units and monetary terms. Cost, sometimes we include those of implementing an intervention, and benefits includes those resulting from an intervention, such as medical care costs awarded, and perhaps productivity gains and monetized value of health improvement. So, for example, in Thailand, we have a semi-autonomous organization. We call this is a Thai Health Promotion Fund, which is a semi-autonomous organization financed by the sin tax from the tobacco and alcohol consumption tax. And we implement many policy on the public health policy and public health program to improve the population health, improve the promotion, and improve the disease prevention in the country. And SRI and perhaps the social return of investment has been implemented and introduced to assess the cost benefit of the public health intervention. For example, we have a SRI on campaign on stop drinking for 3 months during the Buddhist Lent. And we also conduct the SRI on campaign on increasing individuals' physical activities to fight against NCD. This is an example of implement any public health policy to improve the population health. That's our experience and response.
Thank you, Dr. Pusit. Thank you very much. I'm going to bring in Susan here right now. Susan is from the private sector, many years with Pfizer. She's retired already, and her mandate was the emerging markets. First of all, Susan, thank you. I know it's evening from your neck of the woods, so thanks for spending time with us here. Now, listening to what the governments are concerned with from the private sector angle, Susan, you've seen the changes over the years, 20 over years with Pfizer in the emerging markets. What's your perspective here?
Well, I want to thank you for inviting me to join this very distinguished panel this morning. Private sector already discussed, which is the importance is not sickness, the importance is health. And I believe very strongly, and I have for a very long time, that is, the power is the combination of a good Ministry of Health, public health and otherwise, combined with a Minister of Finance or Ministry of Finance that really understands that investing in health is investing in wealth for the society. And we've certainly seen it through this horrible pandemic, that when our health fails, so does our economy. And so I think, if nothing else, coming part of that discussion around investment in healthcare is critical to the future success of surviving and perhaps even, dare I say, thriving in the next pandemic, which we know will come. Certainly your parts of the world have experienced more viruses than my part of the world in the last decade. COVID was new to us, but coronaviruses are not new to the Asian region by any stretch of the imagination. And I do believe the private sector is very willing to discuss interesting and creative ways of financing healthcare investments, looking very much at the idea of keeping a healthy society. I think the interesting discussion on return on investment, that of course is important from a finance minister's perspective, because health is just one of many investments that you need to make in a sovereign nation. But when you look at the return on investment in health, for example, after clean water, vaccinations have been the greatest return on investment in public health the world has ever seen. And there is actually data to show that more children that are fully vaccinated, and I mean children from infancy forward, produces a bump in the GDP of a nation. So there is hard data to prove that this is an investment that is not just about health, it's about wealth. And with a healthy society, you can have a healthy economy. So I think the private sector certainly does a lot of work around return on investment. As I have always said, just like governments, you're using other people's money to do something, and you have to be a steward of that money, and you have to understand what kind of return. In the case of public health, I think we can all look at the return being a healthy society, and we all can look at it at a metric that will be acceptable to all of our stakeholders, whether they're citizens, civil society, or shareholders, stakeholders, employees of companies, to make sure that we make investments that focus on health and not sickness.
Okay, Susan,
thank you, Jennifer.
We hear you. We hear you, Susan, and I'm sure you're hearing too of the new demands on the private sector and sense of purpose and responsibilities, and maybe we can get back to that later as well. Let's move on to the MDBs. Ahmed and Hun are with us here. ROI keeps coming up a lot as well. You know, it is important from the view of the MDBs as well. As you are dealing with the new priorities, how are you looking at some of the trade-offs you're seeing with the countries you're engaging, and even that call for ROIs? Are they the same today as they were 5 years ago? Amin, maybe we'll start with you first.
Okay, thank you. Thank you so much, Jennifer, for having me, and very grateful for the opportunity to be part of this very distinguished and diverse panel. You know, I think the conversation up until now has highlighted just how complex this subject is. The reality is that the tools we use to measure the impact of public sector investments and budget allocations, in fact, are totally imperfect when applied to the subject of human health and human flourishing. And I think that's what makes this conversation right from the outset so incredibly difficult and complicated, because we're talking about things that we all know from the beginning are priceless and invaluable, and yet governments must make very difficult trade-off choices between health and between other sectors. Minister Wong talked about the trilemma between universal access, quality, and cost. And I think, of course, that always exists in the moment, but the path out of the box, I think, is the thing that was highlighted by His Excellency Dato Dr. Amin, which is that over time, and with appropriate investments in technology and in R&D, we can keep pushing out the frontier of what's possible in the context of the trilemma. And in this context, I think turning just a bit towards the comments from Susan, I'd refer back again to Minister Wong's comments about market structure. I think, you know, before getting to the question of trade-offs, one of the most important things that governments do are they design the backdrop against which private sector actors measure risk and return. And getting that design, I think we've all found, is extraordinarily important because the private sector will naturally seek to optimize within the guardrails that it's provided. And that can be highly efficient and effective over time, or it can actually create inefficiencies and pockets of sort of welfare loss that we have to avoid. You know, maybe just one last comment I'll make, Jennifer, on the subject of trade-offs. It's a relatively specific one, but it's an important one, and it's reflected in our work at ADB. And that is that, you know, one thing that we found, and now I'm going to pivot to after a disaster or pandemic strikes. One of the things that we found is that the architecture of fiscal support in the post-pandemic environment actually has a really important impact on how different elements of society are affected. In fact, we've done some very interesting research at the ADB measuring how various government interventions have affected outcomes for people. And one thing that's really, really powerful is the timing of support. So one of the things that we've discovered, for example, is that a dollar delivered immediately in the aftermath of a pandemic or other such event, you know, that can be worth as much as $5 delivered much later. And the historical way that governments have responded to public health emergencies, which is reliance on budget support, on reallocation from other budget line items, and from external borrowing, this architecture is really imperfect and incomplete. There's just way too much risk around whether the government will in fact be able to respond in a timely and meaningful way. And so one thing I just wanted to mention on the subject of trade-offs, because sometimes there's a better option within the existing set of choices. And one thing we found at ADB is being able to fund early. A response is very powerful. And so one of the things that we're doing around the region is working with governments and regional entities to design viable risk financing instruments, whether those are through insurance forms or other things, that provide much quicker dispersing funding in the aftermath, both of disasters writ large, but also in the aftermath of pandemics. And I think this is one specific area that holds some promise for giving us a path towards better outcomes.
Amit, thank you so much. And Han, the role of AIIB here?
Thank you. First of all, thank you again for giving me this opportunity to join this distinguished panel. And AIB itself is a new development bank, only now 5 years old. And AIB created a new group, social development infrastructure group, which is focusing health now. So we would like to play a more active, proactive role in the health sector. And having said that, let me start with the pandemic itself. Personally, I believe that we are entering into the end game of this pandemic, whether we admit it or not. The main reason is the supply situation. Globally, we've been following the production of vaccines, and last May, June, globally, the monthly production reached 1 billion doses a month. And by now, the production is 1.5 billion doses. And soon, within next 6 months, it will reach 2 billion doses. So the pandemic is definitely, whether we want it or not, is entering into its final phase. And the socio-economic damage and related cost of pandemic are billions, and people and economy and country cannot bear anymore the current lockdown situation. So now is the right time. We need to engage in post-emergency support to make health system more sustainable and resilient to health security threat. Of course, at the center of all this is financing. And the emergency support during the crisis, we all know, is just a quick fix and limited fix of a health system that contribute to resilience and sustainability only marginally. Now, building a strong health system calls for sustained and commensurate funding of the health sector. For instance, WHO set a minimum benchmark of health expenditures equivalent to 5% of GDP, and ideally also with no more than 30% of out-of-pocket expenditures. However, the statistics show that most countries in Asian developing countries, including, let's say, Malaysia, even China, Indonesia, Malaysia, Sri Lanka, India, are barely or far from meeting these low benchmarks set by WHO. Now, to reach WHO's benchmark will require, first of all, political will to allocate adequate resources and build decent social protection systems, including health insurance. But for short-sighted governments and politicians with the competing needs for investment, spending today to reap the benefits during the next pandemic, which might be 5, 10, or 20 years away, is a very difficult decision. And already, I believe that there is a sizable risk that the lessons from COVID-19 will not be followed by establishing sufficient and stable funding for the health sector, especially public health, distinguished from the personal health. And I think this is pretty increasingly more obvious given that countries are under severe stress caused by deficit financing during the COVID-19 pandemic period. And now the pressure on the public finance will even increase in the next few years. So we are entering the end game. Now it's the right time to prepare a plan to prepare for the potential next crisis. And have we really started our work to develop a roadmap to position ourselves another crisis and to avoid such a huge economic and social cost. About what as a development bank, AIB is planning to do or is doing, maybe I can talk about it a bit later if you give another chance.
Thank you so much, Chan. Indeed, sober reminders of what needs to be done as we go ahead. Dr. Amin, you've heard the other panelists as well. Much funding needed. Do governments do it alone? Do you need to bring in new players now? Is there a role for really a spectrum of people to participate in solutioning?
Yeah, thank you, Jennifer. So thank you for all the various intervention. I think they're all very interesting and inspirational. So I think in the case of Brunei, we could look at private sector healthcare. I think the private sector can come in and play a big role, so that the resources from the government can be a bit more focused on areas which are omitted by the private healthcare. And that way, I think we can reach out to more people. And also in the case of Brunei, private healthcare insurance is quite negligible at the moment. So as long as, if we can get people to take some responsibility in funding their own healthcare, so I think that will also help to alleviate the government's burden on funding healthcare. So I think these are some of the measures that we could potentially introduce. But of course, at the end of the day, I still come back to technology. How do we, whatever budget that the government allocate, how do we spend it wisely and smartly? And how do we use technology to help us improve the way we allocate the spending in the right places? I think, again, so I couldn't emphasize more on the importance of technology.
Indeed, Dr. Amin, and we've seen how well Brunei has used technology to combat COVID-19 as well. Minister Wong, if I can move on to you, sources of funding. Again, the same questions I posed, Dr. Amin. Do you see a wider spectrum of sources being made available that can be tapped upon, and not just the government, and even if it's the private sector, in a new form at least?
Thanks, Jennifer, for the question. I fully agree that we do need to put in more investments into this area of public funding. This must happen at the country level so that every country is better prepared for the next pandemic, the next public health emergency. As Mr. Kim said just now, we have to start preparing now for the next pandemic. Singapore learned this lesson because we had the SARS experience, and after SARS, we invested more in public health. We set up a National Center for Infectious Disease. It could not have come at a better time. The center only started to open before SARS-CoV-2 broke out and we had the new virus. And it was a huge capability, this new center, in helping us fight COVID-19. So all of us have to do more at the national level. But I'm afraid it has to go beyond national spending. The fact is that the global system for public health is fragmented, is inadequate, and is underfunded. There is no doubt about this. The G20 had a high-level independent panel chaired by our senior minister, co-chaired by Senior Minister Taman, Larry Summers, and the former Nigerian Finance Minister, Nozi Konjo. And they put out a very good set of recommendations on this matter, recognizing that in order to be better prepared for the next pandemic, the entire world, we will need better early warning systems. We will need to better control infectious diseases. We will need a better system of vaccine manufacturing and distribution. Otherwise, we are back, where we are today, tackling the next pandemic, which will surely come. It's a matter of time. And all that means additional investments at the global level to the scale they estimated of $15 billion a year, $15 billion, double our current levels of spending. And that may sound like a large amount, but when you look at the cost of the pandemic, I think it's a premium, it's an insurance premium that is well worth paying. Now then the question is, how can the world come together to do this? So it's a big, challenging issue, but it's extremely important. It includes strengthening the WHO, Number two, having new multilateral systems or even funding mechanisms that can mobilize the investments that are needed for pandemic preparedness and prevention. And thirdly, the panel, interestingly, talked about the importance of having a governance structure involving both health and finance ministers. I think a point that Susan talked about, the partnership between health and finance being extremely important. So these are ideas that are being discussed at the G20 and at the multilateral levels. I think we do need to strengthen multilateral platforms and institutions to ensure additional investments at the global level. And then beyond that, certainly we should widen partnerships in different areas. At the regional level, we are already doing our part in ASEAN, and I thank Dr. Amin and the Brunei government during their period as ASEAN chair. They have indeed started several key initiatives around vaccine security, regional reserves of medical supplies, or strengthening our regional capabilities for public health emergencies. So these sorts of regional public partnerships will complement the multilateral initiatives. And then, of course, at a different level, we would look at partnerships, including with the private sector. I think that's also very important. And certainly from Singapore's experience during this pandemic, the partnerships, the public-private partnerships have proven to be extremely important in enabling us to fight the virus, to set up new facilities, and to get new capabilities put together in a very short time. Indeed, the whole vaccine development is the ultimate success story of public-private partnerships. So finding new mechanisms for stronger public-private partnerships in public health is also critical.
Indeed, Minister. In fact, that G20 PPR report mentioned government, private sector, and philanthropies. And it's something, Temasek Foundation, as a key philanthropy organization, is very much cognizant of as well. And we too see the responsibility in playing our part in all of this. Dr. Pusit, what is your view? An expanded base for the commitments needed to finance health?
Yes, from the health professional and perhaps the public health perspective, I think that is we are very grateful to the government and perhaps from the Ministry of Finance in providing adequate financing for public health in Thailand. Because I just would like to share with you that Thailand, we have the policy to provide universal coverage of healthcare and perhaps health insurance coverage to the entire population. So what we finance public health program and perhaps public health care in Thailand is that we try to use general taxation. It's the main source of finance for the Thai public health system, because we try to achieve the target of the universal coverage, and perhaps from the WHO proposed by the WHO that we try to reduce the out-of-pocket payment expenditure, perhaps the proportion of out-of-pocket payment expenditure to be less than 20% of the total health expenditure. So this is the target of the Thai government on the policy on the universal health coverage. And we also set up some things like compulsory contributory public health insurance scheme. We call it, this is a social security scheme from the formal sector employees and employers. So you can see that we have so many sources of finance for public health system in Thailand. First one is on the general taxation from the government. Second one is the contributory from the public health insurance compulsory scheme. And yes, of course, the next one is on from the out-of-pocket expenditure from the household spending and private sector. And I just would like to share with you that from the last one, we just recently we just set up some things like syntax organization. which is we call this is a Thai Health Promotion Fund and Thai Health Promotion Foundation to implement the public health policy and public health program and health promotion and disease prevention program in the country as well. So I think this is perhaps the commitment and what the Royal Thai government give the priority to public health system and insurance system in Thailand.
Well, thank you.
Over to you, Jennifer.
Thank you so much. Actually, if I can come back to Dr. Amin one more time before I move on as well. Listening to all of these sources of funding, the call for new sources of funding as well, Dr. Amin, how do you measure the return on investment on these fundings and on public health?
Thank you, Jennifer. So I think in the immediate term, I think our focus should be to try to vaccinate our people as quickly as possible. And the ROI will come in the form of helping us to recover, our economy to recover sooner rather than later. So, and a longer term, I think we don't see ROI in terms of financial return, but more in terms of, having a healthy population will translate to greater productivity, and therefore it will giving us a better economic growth prospect. And also, with a healthy population, you have a better society as well. So I think how do we do that? So that is where we come back to technology. So in the case of Brunei, we invest quite heavily on our application called Bru Health. If it is no longer a so-called contact tracing application, we are kind of incorporated into a public health management system. And so if we can use these systems to predict, say, 20 years from now, the type of common disease and illness that we're going to foresee. So then we can plan ahead. And instead of trying to prepare, as I said, a number of beds and doctors and so on, we can also put in place some preventive sort of so-called healthcare to make sure that less people need that, or less people fall sick based on our sort of prediction, with the current lifestyle. So I think that these are the investment, in my view, that will give us the return, not necessarily in the form of financial return, but in terms of creating a better society and people stay healthy, not necessarily because they get better treatment, but because it allows us to actually put in place some preventive healthcare measures in place. So I think these are how we see return on investment rather than look at sort of in monetary term.
Well noted. Well noted, Dr. Amin. I mean, I do recall that the theme that you have for this whole conference is a happier and healthier outcome. So it's not just health, but happiness as well. So well noted. I just want to move on to Susan. Susan, must have been music to your ears to hear Minister Wong talk about the partnership that's needed, private and public as well. This is after years of the private sector almost being outside the circle of engagement.
Yeah, Jennifer, I think you're absolutely right. And I believe very strongly that the private sector has always had an important role to play in healthcare. But generally speaking, private sector actors weren't always invited to the same tables. There was a government conversation among various ministers. There might be the involvement of a multilateral development bank, but the private sector was sort of kept at arm's length and maybe in another room or came in at the end for dinner, but wasn't really in the entire conversation. And I think if nothing else, the COVID-19 has proven the public sector has contributions to make and has a lot of knowledge, especially in the realm of infectious disease and healthcare. There's a lot of organizations out there, companies, big and small, that have done groundbreaking work. And I do think that also from a technology perspective, there's so many technologies involved in these solutions. So what I'm hoping that will happen as the private sector is welcomed more to the adult table and not at the kids table, to really actually be engaged in the dialogue from the very beginning. I always remind people that medicines and vaccines, you know, it's not a recipe book. It's an invention. There are people that sit around and look at data and invent a solution. And I think if the private sector can be seen as an inventor as well and an innovator and someone that can bring ideas to the table as well as funding, I'm not going to shy away from that point because this is a conversation about financing. But I think everyone should be welcomed at the table. Everyone should understand the point of view of the other. Everyone should respect that in the center is the solution, which is a better public health system, which leads to a better economy and a healthier population. And that I think the private sector is a valuable actor. And I hope, I really do hope that the future brings more invitations for private sector into discussions like this at the earliest stages and not at the end, which is, well, can you just send us your product, please? Because that's not the way good innovation happens.
Well, Susan, the expectation is that it's not business as usual, then the private sector will have to behave differently if it's going to be invited to the table early.
I agree with you, Jennifer. And I think it probably has been more recent than people realize, or more prevalent than people realize in pockets. But I think good private sectors actors come to the table with a sense of what they're going to give, not just what they're going to get. And I think that's what's so important about a true ecosystem in global public health. Now, I don't believe, and I think all of the speakers have said this, I don't believe that everything can be done at a global scale. I think regional collaboration is critical. And then I think in the end, each country has to implement the solution in the way that fits their needs, fits their society, their culture, and their infrastructure. So I believe, and I did have a chance to look through the G20 report, I believe that we must strengthen the global guidance and the global leadership, but global is not going to do the surveillance in each of the individual countries represented today by the panelists. Each country is going to have to take their own responsibility. Now, they can get support and guidance from global institutions. I think that would be fabulous. And there can be a lot more regional collaboration, whether it's manufacturing, whether it's regulatory, whether it's healthcare policy. I think that would be great because we are all global citizens. But I do believe that the private sector, if we want a seat at that table, I think we've earned it. Now we have to prove that we belong there.
Okay, Susan. Regional cooperation, definitely, but global public goods, they're seen as important. So Ahmed and Han, the call again at the G20 PPR report is for global public goods to be part of the mandate of the core mandate of multilaterals as well. Ahmed, how do you see it from your perspective?
So I think, Jennifer, I think the problem's a little bit more complicated, in fact, even than that. I think our institutions have for some time now recognized that global public goods are central to our mandate. The real challenge, I think, goes to organizational structure and sort of multilateral system design. And I think there's probably broad acknowledgement that really difficult, complex problems need whole of society responses. And the institutional capacity of all of our societies to a significant extent lies within the private sector, and certainly a lot of the creative and dynamic institutional capacity. I think one of the challenges that we've started to focus on, and we are very focused on at the ADB, is creating platforms that are fit for purpose to mediate that conversation in a way that's productive. And I don't think that our current architecture really is designed for this. So one of the changes that we have been trying to make at ADB is to try to pivot from being what has been to some extent a closed architecture organization, one which has phenomenal economics talent, phenomenal project managers, phenomenal relationships with countries, to one that recognizes that over the last 20 or 30 years, in fact, a whole host of private sector firms are development actors. And they're obviously they've been health actors for a very long time. And we as an organization, I think, sit at this pivot point where we can mediate between public and private sectors, certainly at a regional and global level. But it demands something different from us than what we've been traditionally used to doing. This is something that we've started to do in the climate space. It's something that we're certainly moving forward to do in the health space as well. And I think within that comment is also a bit of a commentary on the dialogue that we've just had around the breakdown of global governance. because one of the issues I think we're confronting globally is that as the architecture of power and the relationships between states and regions shift, some of our underlying structures are not as capable and as effective as they have been historically. I think that may lead, as Susan talked about, to the emergence of new regional platforms where it is, easy to be a bit more nimble. And then the last thing I'll say, is that, the big difference, I think, between countries that performed well, and well, of course, is a relative term, in the aftermath of COVID and those that didn't, I think the big unacknowledged difference is that, in fact, it has to do with prior experience. So the countries that had been through similar things before, SARS, MERS, they had built up an institutional response. So one thing that it behooves us all to do as we move on from this particular health crisis is that globally and regionally and nationally, we all have to make sure we internalize the lessons and build the structures we need so that we're more effective in the future.
Thank you, Ahmed. Very, very reflective indeed. Han, as we, not coming out of COVID, as we go through COVID as well, what are the changes that need to be done for AIB, for mandate and structure?
Right. So, for instance, the vaccine is proved to be a global public good. Now, when there is a market failure, the market cannot match the supply and demand, and market failure, and there is a government failure. So the cost was very high. So at one point, even a couple of months ago, there was a lot of debate. Okay, so maybe vaccine production globally should be designed and planned so that the same mistake experience will not repeat. But in the end, maybe no global consultation can solve that problem. Because what is happening in vaccine production, for example, is between sovereign nation and private sector supplier. So all the contracts are negotiated and concluded bilaterally between company, and so that is very difficult the public sector to intervene in that commercial process. But on the other hand, somebody like WHO, and I believe even IMF, can play the role of information center, So at least we know how the market moves and who has the production capacity and where the demand is, and at least to facilitate market information. So after this pandemic, I believe there'll be already many countries are contemplating to build their own vaccine production facility, and which may not be necessarily the most economical solution, but this has to be resolved, I think, by the market mechanism. Having said that, as a multilateral development, we see one clear trend, which is localization of healthcare manufacturing. I think during this pandemic, there has been a shortage of many things, like medical devices, medical equipment, and even pharma products, API. So we expect that there'll be new trend will develop, kind of the decentralization or domestic production, local. I call it localization of manufacturing. So this will be a trend, and even pharma industry and MDBs, I think we will have a role to play to facilitate such a thing. And between global and regional, I also agree that the regional platform will work better. Like in ASEAN, in pharma industry, I see an opportunity in medium to long term, harmonized drug regulations, the drug regulation. So at the moment, the pharmaceutical products are mostly dominated by a few multilateral companies, but increasingly there are new suppliers from emerging big countries like China or even India, I think, and the ASEAN countries can start develop their own local facility. And I know that like Singapore already has a plan to take a lead in that kind of initiative. On top of that, like in ASEAN countries, we talk about a lot about One Health, animal health and human health. All these pandemics, we all know this animal health is important, but this public health side is even more remote than general public health, so nobody will invest in it right away. But for ASEAN, for instance, the movement of livestock across borders, and expanding some kind of surveillance system and cooperation between the expansion of a laboratory system to include animal health and cooperation among countries, data sharing and more research. I think these kind of things on a regional basis can happen, and MDBs do have a catalytic role to play here. And finally, the underfunding of health system, which is a core problem, this will continue. But I think more money is good, but the allocation of money is also important. For instance, we should allocate more money to primary health care. Money not necessarily going all the hospital. This pandemic experience already proved that. So many developing countries really should focus on primary health care network. So let me stop here.
So Han, what do you think of the idea of pandemic insurance then, public health insurance? And I'll ask Amin as well.
Pandemic insurance is a good idea to talk about it, but it will be very difficult to persuade and convince people to pre-buy something which has not happened. Even government will not set aside the ring-fence public finance for the pandemic which will arrive, and it's very difficult to convince individuals to buy such insurance. So in my view, it has to be a role of public sector and public health to prepare for it. In that regard, definitely the role of finance ministry is absolutely important. That is why I saw even before the pandemic, the actual IMF itself was kind of taking a lead in health sector in a big way, so that the finance ministry can work together with health minister. But I think it's not bad that the IMF will take a lead, and I hope that the initiative will continue. It was disrupted during the pandemic, but I hope that, and then that public sector role is more important in my view. Thank you.
All right. Ahmed, your view on public health insurance, pandemic insurance?
Yeah, so I think that I definitely agree with Han, and as I said, I think earlier that these are important tools, and one of the things that we do need to do is make sure that the money is available quickly, and this is one way to certainly do that. There's a number of other things. I think Dr. Prongsansai mentioned sin taxes. I think that's another important avenue for funding health. Soft earmarking of additional revenues for poor health programs, I think, is certainly something important that can be done to expand coverage. One thing that we've started to talk about in the aftermath of COVID is debt relief for health as another way to sort of create fiscal space. And then, of course, there's much more that we can do on improving the efficiency and equity of existing public spending on health. So I think there's a lot of wood to chop, as they say, both in terms of unlocking new sources of capital for public health, but also getting more from the money that we do spend.
All right. Well, time's running out. In fact, I think we've overrun this session a bit, but the organizers have given us a bit more time. So I just want to end off with one question. It's actually a roundup question on what the collective ASEAN action can be, should be? Susan, I know it's a bit tougher for you to look at that, but you can take a broader view. But the collective ASEAN action, and I want to give the last word to Dr. Amin, so maybe we'll just work backwards. But I'll start with you first, Susan.
I think just the conversation about collective action is the most important conversation to have right now. I agree with, I'm not sure who pointed it out, but my last international trip before the pandemic was actually in Singapore and Indonesia. And Singapore had already enacted their pandemic plan. It was already in full force. As I went through the airport, I was questioned where I had been. So preparedness was evident in Singapore when I was there well over now a year ago. So I think the idea of collaborating first regionally and then globally, that's probably the better order, and to make sure that as a region, you draw upon the incredible resilience that you've shown, not just from COVID, but through many pandemics that have hit the ASEAN region much harder than perhaps the rest of the world. And I think bringing the private sector into those conversations for both the good and the bad and the ugly. There have been a lot of hiccups in this pandemic, despite the experience, and there's been a lot of bumps in the road. But I think now is the time to bring everyone together at a regional and perhaps even global level, all actors, philanthropy, multilateral organizations, development banks, the private sector, and governments, to figure out really the very simple things of what worked and what didn't work, and what should we start, what should we stop, and what must we continue to be even more prepared for the next time around. Thank you for having me, Jennifer, and thank you to all of you.
Hope to see you soon in Singapore then, Susan. Han,
Indeed.
your idea?
Yes, for ASEAN. Okay, for countries, I think the government must start preparing, let's say, 5-year plan and bring funds, the expenditures for healthcare and roadmap to prepare for the next pandemic. But beyond ASEAN, I think it is important also, or at ASEAN level, or at the WHO level, that some arrangement or governance structure to prepare for the market failure. So when market fail to properly distribute global or regional public good, how the regional cooperation structure like ASEAN will handle it. I think they have to start think about those things too.
All right, thank you, Han. Ahmed?
Well, just to be brief, I would say learn the lessons, and apply them, and make sure that we have the structures that allow us to apply them in a whole of society manner. And understand that the lessons and the points of failure that we experienced in the context of a health pandemic also exist in other critically important areas of common concern and shared outcome, the most significant of which is climate. So I think that's what I would say. Learn the lessons and organize ourselves for an effective collective response, recognizing that what we have seen is much bigger even than the enormously large subject of public health.
Thank you, Ahmed. Dr. Pusit?
Thank you very much, Jennifer. I would like to emphasize perhaps the word from the WHO that no one is safe until everyone is safe. So this is the importance that we should have to strengthen regional health collaboration among ASEAN countries and among ASEAN members. And I think that we should try to strengthen countries and regional preparedness. I agree with Susan and all of the previous speakers that we have to expedite the ASEAN recovery framework and support research and development in this region. Thank you very much.
Thank you, Dr. Pusit. Thank you. Minister Wong, ASEAN Collective Action.
I think if you look at what happens after a financial crisis, and we have had many such experiences, we have strengthened both international, multilateral, as well as regional responses. For example, after the Asian financial crisis, we have a better system for surveillance, for monitoring, even swap initiatives like the Chiang Mai initiative at the regional level. And so if you take a leaf from how the region grew stronger, more resilient after financial crisis, in the same way, we have to build better mechanisms to prepare for public health crisis and emergencies. And that can include, at a very simple level, better exchange of information, coordination of public health measures, including border measures, to initiatives like risk pooling and sharing of resources in order to better respond collectively to a public health emergency. And those are things that ASEAN governments can and will be doing. I would also say, just a very small point, that, you know, a lot of, I think arising from a crisis like this, there is inevitably a better appreciation for the role of government and the role for multilateral institutions, no doubt. But let's not swing to the extreme. Let's make sure we find the right balance too. Because if every country says, I must do everything within my borders because I am worried about dislocation of supply chains and I cannot trust the global marketplace, I don't think it will be a better world, nor do I think we will achieve better outcomes. Ultimately, we still need to go back to public-private partnerships. We still need to work collaboratively with different stakeholders, all of whom are important, including philanthropic organizations and non-profit organizations. And I think it's that kind of collective response that will best enable us to prepare for the next pandemic.
Thank you, Minister Wong. And Dato Amin, on the ASEAN collective action.
Yeah, thank you, Jennifer. I'd like to refer back to what Han from AIIB mentioned earlier on about we need the so-called a 5-year plan and so on. I think as we have discussed among the panelists here, we all understand that there will be another health crisis sometime down the road. So as we have seen in 2020, you know, if we were to support many of the health initiatives, we need to make sure that, you know, the economy continue to function. So in 2020, many economies suffered a severe setback. And together with a lot of this sort of a massive funding for COVID-19 rescue plans, and that actually resulted in many countries incurring budget deficits. So not many countries can continue to sustain that for the second year, let alone many years to come. So I think this is where we, you know, if we were to recover from this adversity, we all need to come together. I think this is where ASEAN believe that, you know, if we were to come out of this, we need to work together on this. So of course, in ASEAN, there are many initiatives. Minister Lawrence Wong talked about Chiang Mai initiative, multilateralization. But again, that, you know, that is a very short-term so-called liquidity sort of assistance. And, you know, even if you look at ADB or AIIB, that won't, these are mechanisms that allow us to kind of tide over short term, but it doesn't actually help to solve the problem over the long run. And so this is, you know, crisis like COVID-19 pandemic. I think we need a more comprehensive framework that allow us to recover better and stronger, and also to shape the future of our region. And this is where the ASEAN Comprehensive Recovery Framework comes in, or ACRF. You know, today, I think if you look at this ACRF and implementation, it provides immediate measures. It also provides us mid to long-term measures from each phase of the recovery. I think there are 5 broad strategies under ACRF. It includes, you know, enhancing our healthcare systems. How do we encourage more intra-trade within ASEAN? How do we ensure that we accelerate the inclusive digital transformation through digital technology, and so on. So all of this aims towards how to look at ways to boost our economy, to improve our society in this post-COVID-19 era, and also to achieve long-term resilience. I think these are some of these major so-called sort of objective of ACRF. But of course, you know, at the end of the day, it all comes down to implementation. So within ASEAN, I think we have also supported the setting up of so-called ACRF unit within ASEAN Secretariat. And so this unit will make sure that they kind of oversees the implementation and in a timely manner. So as of end of August, we have about 185 initiatives. So out of which 40 have already been implemented, and there are 60 over which are in the process of being completed, and there's another 60 plus which just commenced. But there's also others which are more for longer term sort of implementation, so that it looks at how to align the recovery and resilience in the future. So some are done this sort of in the immediate term. Some are for the longer term. So I think to emphasize again, we need to all come together. So just quote one example. If we were to recover from this tourism downturn, how do we use technology to, as mentioned by Secretary General yesterday in his opening remarks, to have a mutually recognized digital vaccination certificates or documents, and that allow us to start getting things moving and bit by bits, and then we can look at many other sectors. Because I think if we don't work together, none of us can actually recover from this adversity on its own, because we need sort of a regional collaboration, and in the future, if not even beyond this region. So I think ASEAN recognized the importance of working together, and this ASEAN Comprehensive Recovery Framework is a very important document that will set the scene for us to recover from this adversity. So I think ASEAN Secretariat is doing a great job on this. And as I said, the unit is monitoring it very closely. And so we are confident that if everybody sort of work together on this, we will come out of this and be better prepared for the next pandemic. Thank you, Jennifer.
Indeed, thank you very much, Dr. Amin, and thank you, Brunei, for the lead on the ACRF. We've run out of time. It leads me to thank everyone for the insights and to ask all to stay safe. Thank you.